Fan, Head of Communicable Disease Branch, CHP, and Dr. Lau, Chief Manager of the HA. Dr. Chang will report on the cases. Last night we confirmed 18 cases, numbers 11381 to 11398. 5 males, 13 females, aged 23 to 71 years old. Among the 18, 13 were imported cases. They came from Philippines, 9 from Philippines, 3 arrived on the 20th of March, 5J272, and then 20th of March, PR330, and then 3 came on the 9th of March, taking flight 5J572, and they were the 12-day samples. And the other 6 were tested positive at the airport. 9 from the Philippines, 6 of them had M501Y strain or variant. Another 2 imported cases from one from Indonesia and one from the Pakistan. The one from Pakistan came via Mideast EK3843. The 19th day sample tested positive. The Indonesian case, it took SQ882, arrived on the 20th of March from Singapore. The remaining 7 are local cases, among which 2 were unknown sources and 5 were linked to other cases. The 5 were all confirmed at the quarantine centers. All of them were related to the Ursus, the fitness room. 2 close contacts, 1 staff member, and 2 customers of the Ursus. Altogether, the Ursus group had 147 cases, among which 8 were staff members and 9 were customers. 46 were close contacts. As for the variant cases, 7 more. Altogether, 106 were variant cases with concern. 37 the UK variant, 8 from South Africa, and 5 from Brazil, and 56 not yet classified. As for the unknown sources, for the time being, 11394, I mentioned that yesterday, a part-time taxi driver, red taxis, plate number LE7673. On the 3rd of March, on the 10th of March, on the 17th of March, he worked on these 3 days. He worked the morning shift from 6 or 7 a.m. to 3 p.m. He handed over the taxi at South Horizons. We've asked the office to provide for those taking taxis 8 to the 17th of March, if they have the Leave Home Safe app, those people will be informed if they took the taxi. Please go to take the test. As for the taxi driver, he mainly took his meal at home. He didn't have a lot of activities. He lives in Siu Sai Wan, Shui Lok House. The building is subject to compulsory testing. The other case with unknown source is a clerk at the work site at the Chakoling Road site. This is a CEDD, seawall and fairway maintenance contract. The number is CV 201601. There are about 100 staff members and we will issue a compulsory testing notice. Those working with the patient at the office, about 10 of them have to be quarantined. The person had a sore throat on the 17th of March, and he worked last day of work on the 19th, and then testing on the 20th. He had a negative test result on the 6th of March. The patient lives at Scenic View, Ao Chi Wan, Fengxing Street. And the building was also subject to compulsory testing. During the incubation period, the patient had meals with 1 or 2 colleagues. On the 14th of March, the patient spent some time with family members at a farm in Yunlong having barbecue. Well, that was a few days ago. That's by and large the situation. Apart from these 2 buildings, which are subject to the compulsory testing notice, other buildings with linked cases have also to be tested, and they are Cane Row, 43 to 45, Central 8, Sai Ying Pun High Street, number 98, Kensington Hill, and Cane Row 99, Elbrin Court. As for the workplace, which is also subject to the CTN, and we also have one nursery which has URST outbreak, a few students. Waterloo Road 111, the Canaan Nursery. About 300 students and 30 staff members have to be tested. There are about a dozen or so preliminary positive cases, and most of them are imported cases, and about 3 of them are related to the Ursus Fitness room. They are confirmed cases at the quarantine centers. At present, there is one patient who is of an unknown source. The person is an 88-year-old male, a retiree. He lives in Ping Tin Estate, Ping Sin House, Lam Tin. This is also a building subject to CTN. The confirmed case is different, is a different orientation. He does not recall his previous activities. His family members knew that at about 8th or 14th of March, he visited the Chiu Fuk seafood hot pot restaurant in Lam Tin, Kai Tin Mall. In fact, there were previous cases at that restaurant. The 2 patients had contacts at dinner time on the 10th of March, but as this person went to the restaurant in the morning, we are checking whether they know each other and whether there is any chance of contacting each other at the restaurant. The restaurant has been closed. About 20-odd staff members are working there, and 9 had already been sent to quarantine centers because of contact. They had some tests, and we are following up other staff members. We have asked the Yojo to do this. Those who have been to the restaurant since the 8th of March would receive the message asking them to take a test. We try to find out whether there are other cases arising from that. That's what we are following up.
Now, Dr. Lau will report on the hospital authority situation. In the last 24 hours, the HA has recorded 28 reported cases. In the 24 hours, 26 more patients have been discharged, and up to now, there are 10,901 patients who have been discharged. Until 9 a.m. this morning, 245 patients are in 20 hospitals, and also North Lantau Hospital, Hong Kong Infection Center. 10 of them are critical, 10 in serious condition, and the rest, 225, are in stable condition. Up to now, we have opened 1,184 negative pressure beds, utilization rate 59%, and negative pressure rooms to 648, utilization rate 70%. And I'd like to report 2 cases. One, United Christian Hospital, one confirmed patient in the A&E room. One 88-year-old male came to UCH because of shortness of breath and fever in the morning today. And we did hospitalization screening, and he was tested positive preliminarily. So he was moved to an isolation room, and now he is in a stable condition. The infection control team did some contact tracing at the A&E department. Another male patient did not wear a mask properly, so he was listed as a close contact and he has to be quarantined. A&E department staff have donned proper personal protective equipment and have not done any aerosol generating procedures with the patient, so no staff have been listed as close contacts. Investigation goes on. The hospital has arranged for thorough cleansing and disinfection at the A&E department. Since September last year, public hospitals have done admission screening for all patients. This is a very important measure with the purpose of stopping the spread of the virus in the hospitals, especially from asymptomatic patients. Until now, the public hospitals have done tens of thousands of such screening and have detected 90 cases. This is exactly why we have been able to detect such patients. So they were not able to spread the virus in hospital and also in the community, and other people therefore did not contract the virus. And the other matter is about interpretation of published figures. There have been inquiries forwarded to us about statistics about people feeling unwell after vaccination. Let me explain this to you. Starting from last week, the hospital authority submits to the government newly admitted cases in ICU in public hospitals and also acute stroke rooms, and also patients infected with cardiac infarction. We do it every day, and also in the press release of the government, such figures are released on a daily basis, so the public will understand the situation. I'd like to remind you that such figures include all people who have been confirmed to have contracted stroke or cardiac infection on that particular day, and this is only for reference and contrast. Please do not misunderstand that these figures only refer to people feeling unwell after vaccination. They refer to all people affected by those conditions on a particular day. We just like to release the figures to let the public understand the serious unwell cases so that you can contrast those cases against the overall figures of people who contract the same diseases on a particular day. Now is question and answer session. Please identify yourself and also the agency you represent. This gentleman here. I'm from Now TV. I have 2 questions. Number 1, the clerk working on a construction site, which is an unlinked case. Apart from the Yuen Long site, did the patient go to any place to eat? And would other people have to be quarantined? About the 26-year-old Pakistani male yesterday, policemen have to be quarantined. What is the situation now? The site clerk. During the infection period, the patient went to certain places to eat, and according to our routine procedure, we will inform the eateries to do thorough cleansing. Which ones? We will be able to upload the places online in Choi Won Mall. We have one eatery. And then on the 19th at a Domain Glows Cafe. And then we are following up on the quarantine situation. One immigration department staff member contacted this confirmed patient on the 18th, and he or she had to be quarantined, and the other 16 are being followed up. We have not got any preliminary confirmed cases. Next one, the lady here on the third row.
I would like to ask about the Pakistani man from yesterday. Have you managed to trace any of his other close contacts or his address or where he's been in the past few days during the incubation or transmission period? And I also like to clarify, you said earlier there were 13 imported cases. Is it 13 or 11? Because on the
11.
It's 11. Okay. And I'd also like to ask if you think that it might be worth considering banning flights from the Philippines, because there have been many recent cases from there. Thank you.
We are still tracing the close contacts of the Pakistani confirmed yesterday. Some of them have already been arranged to quarantine center. We are still verifying the address of the patient because the previous address he reported was wrong. And so far no additional close contacts found, but we are still verifying the history. For the imported case, we have 11 imported cases. I'm sorry if I mentioned the wrong number before. For the banning flights, I think we have criteria. If one day there are 5 cases in one day from the same flight, we may consider. So I think the criteria has not been matched, reached today. Yeah.
好，我哋答多個英文嘅問題。
Another English question.
RTHK, Dr. Chuang. Previously, when you announced the Lam Tin seafood restaurant cases, you said it's unlikely that there's an outbreak. But given this third preliminary positive case involving the elderly man, is there a bigger chance that there's actually an outbreak at the restaurant? Is there any extra work that needs to be done? And regarding the CDD clerk at the construction site, did the person actually contact other CEDD personnel? Is there a need to contact trace further beside people who worked at that site? Thank you.
So we still have not yet confirmed any outbreak or concern in the restaurant. The previous, totally there are 3 confirmed cases who had reported visiting this restaurant, and 2 of them had contact with each other. About the third case, we are still investigating whether there's any relation between him and the other 2 previous cases. Because according to the first case, there were some neighbors who they may have contact during the visits. So as a precautionary, we asked the restaurant to suspend service and test all the staff, and also quarantines around 9 staff in the restaurant because they had reported close contact with the previous cases. So whether there's any other transmission in the restaurant, we're still investigating, but we have asked OJO to broadcast for those customers who had visited this restaurant from since March 8th. They will receive a notification and they can go for testing. As for the other unlinked case concerning a clerk in the construction site, she mainly reported working in that site, in the office. So we have quarantined some of the co-workers and put them in the quarantine center. And we'll issue a compulsory testing notice for the other workers there.
好，下一位嗰邊第三行最出嗰位。
The one sitting on the third row, Ming Pao. Good afternoon, two doctors. I'm from Ming Pao concerning the Chiu Fuk lobster restaurant. Can you tell us the situation and what is the ventilation of the restaurant? How do you make of the outbreak in that restaurant? As for the old gentleman aged 88, when was the onset of the illness? Is he the same person at the UCH mentioned by Dr. Lau? No staff member on site has been confirmed concerning the site. But is it necessary to stop work at the work site? And does the clerk also come into contact with the workers on site? Recently, did the CHP go to Ursus Fitness to conduct any checks and find out the reasons why there was an outbreak? Was any environmental problems there? Concerning the preliminary confirmed cases, a case as said by Dr. Lau, it was the 88-year-old gentleman. He had fever on the 17th. On the 25th, he called the ambulance. Or rather on the 20th, he called the ambulance. That was a preliminary case. As for the Chiu Fuk restaurant, we are still investigating whether this gentleman is related to the two other cases. As for the two previous cases, they live in the same building but of different orientation. And when they went to the restaurant, they did talk to the staff members and also neighbors. I don't know whether this gentleman was also included, and whether when this gentleman was in the restaurant, did he come into contact with other people or not. If there was some kind of a link, then it would not be a case with a known source. As for the clerk, she worked mainly in the office, and there might be a chance for workers to come in or come out of the office. There are over 100 workers at the site, and they will be issued the CTN. And those working with her in the office will be subject to quarantine, and a couple of colleagues did have meals with her. We took some environmental samples at the beginning of the outbreak, and we found only negative results. Some of our colleagues went to the site with Professor Yun at Ursus. I refer to Ursus. Now, the person in charge at Ursus was already out of hospital. And what did they find? I'm not sure about it. I know FEHD also went there, but I'm no expert on ventilation. The one on the third row, the second seat, in black. I'm from HKO1. First, on the 88-year-old prelim confirmed cases, how long did he stay at the A&E department? Now, the gentleman in the same waiting area, he didn't put on the mask properly. In what way was it improper? And how was he? Why should he be quarantined? Because as for the lobster restaurant, Choi Fuk, was there an outbreak? Because the old gentleman also went there. As for the clerk at the work site, did she share the same, a common room with other colleagues? Was she identified because of regular testing? As for the old gentleman, 88-year-old, at about 1 a.m., he went to the A&E department of UCH in the same waiting area. We traced the contact, and we found that at that time, the one in the waiting area, the gentleman at the waiting area, also sometimes put down his mask. He stayed there for a few hours. The report was out at about 4 something a.m. and then the elderly gentleman was then admitted to the hospital isolation ward. Now, since the one at the waiting area also sometimes took off the mask, we regarded that person as a close contact and had to be quarantined. As for Chu Fuk Lobster Restaurant, there were 3 cases altogether. They all live in the same housing estate and therefore they frequent the restaurant. 2 cases had contacts with each other. When they had meals, they did talk to each other. That explained the spread. As for this elderly gentleman, we had to trace it further, whether he had contacts with the 2 known cases. Now, if there is an outbreak in a restaurant, we are worried whether the staff members are infected. And if the staff members are infected, then there may be an outbreak or spreading of virus in the restaurant. 9 staff members have been quarantined and there has been no positive case. And we are follow up on each and every staff members being tested. All were tested negative. The restaurant is still closed. If it is not spread by the staff members, is there any kind of spreading in the restaurant to play safe? We have asked OGCIO to issue messages to those who have the Leave Home Safe app who have been to that restaurant and ask those who are exposed to take tests, and if we are able to identify some positive cases, then we'll know more about it. As for the clerk at the work site, on the 7th of March, she had a sore throat. And then on the 20th, she went to the community testing center for a test, and she was tested preliminary positive. She had a test on the 6th of March previously, but it was negative. The one in the last row, in short sleeves. I'm from the Apple Daily. I want to follow up on the lobster restaurant. 11360. Was that case at the same table as the table of the elderly gentleman? Is morning morning time and also meal time and also evening meal time. So is there any cleaning of the tables in the interim by the restaurant? And there is also a neighbor who was also confirmed. What is the number of that case apart from 11360? As for the taxi driver, those taxi passengers would be informed if they had the app how many passengers are likely to be involved. As for the figures to be released for reference, is there any duplication of the numbers for those who feel seriously unwell after taking the jab? Is there any duplication of the numbers? As for 11360, the first one identified, the patient had a meal together or at the same time with 11366. They were sitting next to each other's table. So they are related cases. As for today's preliminary confirmed case, we know is that he was there in the morning, but whether those 2 cases were also in the morning at the restaurant or whether the gentleman was having dinner also the other day, we are trying to find it out. We have to find out whether there is any link. There is quite a lot of information not yet available, and the elderly gentleman doesn't have a good memory.
Every day, we submit figures to the government, which have to do with admission to ICU, serious stroke ICU, and also cardiac infarction ICU. All the patients who have been admitted on a daily basis. If the patient is included in these figures, meaning that there is a new admission into ICU, acute stroke ICU, or cardiac care unit, and then he would have been included. Sorry, I made a mistake just now. Just now, the report should have been released at 6 something, and at 4 something, we got the specimen. But it's just within a matter of hours. The admission at A&E department was at 1 something. The one on this side? Please identify yourself. I'm from cable TV. I'd like to ask for the serial number of the site clerk, please. She went to a barbecue. How many people were there? Would those people have to be quarantined? And also the old man, does he go there every day for morning tea? Or does he go only now and then? And what about those people who were with him? And also we have got single-digit confirmed cases every day now for a few days. Does it mean that the 4th wave has stopped? First of all, the serial number of the site clerk is 11398. Those who went to Happy Garden Farm with her in Yuen Long, those friends and relatives have to be quarantined because hers is an unlinked case, and the onset was on the 17th, so we should include those people. As for going to morning tea, we heard that there was another one with the old man, and we are still tracking down the person. According to family members, and from the 8th to the 14th, he should have gone for morning tea every day. So that person would have to be quarantined. Yes, we have single-digit confirmed cases every day, but still we have unlinked cases. In other words, there's still silent transmission in the community. And I believe the 4th wave has continued. Next one, the one in the 3rd row, please. I'm from Oriental Daily. I'd like to ask about Chill Folk cuisine. Will you send someone there to take environmental samples and to see whether it would be similar to K11 in Chim Sa Tsui, meaning there are spatial problems, so that there was infection? Are you worried that there could be an outbreak? And also the Cha Kwa Ling site, apart from compulsory testing, would you also order a work stoppage and take other measures to prevent an outbreak? We still have to investigate into that restaurant to see whether those people are related. We will have to inform those who have been at the restaurant to do testing first. As for the Cha Kwa Ling site, it has to stop work for 14 days because staff members have been confirmed. This lady over here, I'm from Economic Journal. I'm from Economic Times. It is said that somebody went to Choi Wan Estate, Taoyuan. When was that? And also 147 people have been confirmed in the Ursus Fitness group. I'd like to know how many staff members, how many customers, and how many close contacts have been quarantined. And also the Pakistani male who was confirmed yesterday, it was said that he was not cooperative, so you still cannot track his history in the past few days and also his address. What is your follow-up work like? And if he still refuses to cooperate, what other follow-up action can you take? The Taoyuan production, the site clerk went there on the 21st of March. As for Ursus Fitness, they have 10 staff members and 270 customers. The rest are close contacts, including companies or family members. Altogether, there are 1,500 people in this group who have been quarantined. As for the other person, we'll be investigating from different aspects. Say the reported address would be visited by policemen to see whether he actually lives there. We are still investigating from different aspects. Sorry, speaker not coming through. At the HA and also with us, he reported certain addresses, but those were found to be incorrect. And we would be checking other organizations where there is a record of him, and we will see whether he has been to those addresses. The last question from AM 730. I'd like to ask about the confirmed taxi driver. How many other taxi drivers have been quarantined as a result? And does he go somewhere for breakfast, or does he gather with other taxi drivers anywhere? And also the 88-year-old male, and did he attend compulsory testing for his building? And also, can you tell us when he visited the two restaurants? And also, will you be getting a list of the customers at those restaurants? And lastly, the Pakistani male, you said he reported a few addresses to you, but those were incorrect. Do you know whether it was deliberate or he was just unclear? About the 88-year-old male, he went to A&E department on the 22nd, and it was within the time for compulsory testing. The compulsory testing time was from the 20th to the 22nd. As for the order of visit to restaurants, it seems all three of them went to that place. But this male seems to go there in the morning more often. The other two seemed to have gone in the evening, but I cannot rule out any possibility of them meeting one another because those two sat close to each other on the 20th. But one of them also went there on the 7th and even earlier. We still have to investigate about the time that they went to the restaurant, and that will take time. We will be getting lists of customers from Chilfolk, and we would be sending a message to those people to recommend testing. Sorry, speaker not coming through. Okay, the taxi driver. He said he ate at home and he worked from 6 in the morning to 3 something in the evening, and he would hand over the taxi at Island Resort. I don't know about that. The press conference concludes here. Thank you.